Are you suffering from pelvic pain and finding that every step you take is really wearing you down? Hi, I'm Michelle, and fortunately there are some ways that you can get instant relief from pelvic pain during pregnancy. Today I'm going to guide you through the garments that you can wear during pregnancy to get some extra stability through your pelvic joints, and also I'm going to show you some ways that get immediate relief at home when you're resting, when you're sitting, and also when you're moving around and try to do your everyday tasks. So before we start that, I need to show you where the pain comes from so that you understand where it's coming from, and also by understanding this condition, you'll be able to manage it yourself much better. Now, you'll know that pelvic pain presents normally in the buttock. So it usually presents in one buttock or both buttock cheeks. And it comes from some joints that are underneath those buttock cheeks, and they're called the sacroiliac joints. Now, if we take a look at these joints, I've got them in a model here, I can show you. Obviously, this is the spine, and this is your pelvis from the front. So these are the pelvic joints in here. Normally, these joints are very fixed and closed, and they're covered by some tissues that actually stabilise them and keep them contracted there, keep those joints contracted and stop them from moving. Now, when you're pregnant, these tissues, and you can see the tissues here, become soft. And when they're obviously becoming soft so that your baby can pass through your pelvis, and also with pregnancy, you start to increase weight through your pelvis with the weight of your baby, and your posture changes. So what happens is these joints can start moving with these pregnancy hormones, and it can start any time during pregnancy. Unfortunately, this kind of issue usually gets worse as your pregnancy progresses, and also it can continue happening after pregnancy and in future pregnancies. So it's something that you really want to get on top of well. Now, if we have a closer look at the pelvis, and unfortunately I've got an old pelvis here that actually moves around, so I can show you what happens. So when you have weight through one side, you can see that those joints start to actually move. So this would be when you're standing, the leg comes up through here, hip bone into here, and these joints start to move more than what they would normally. So the treatment is twofold. The first thing we want to do is stabilise the pelvis and stop those joints moving. I think you can see that. The second thing we want to do is also, and you can do that by a brace or by exercises over the joint, but the second thing we want to do is to stop the forces that actually cause that movement. And I'm going to be going through those things with you today so that you can instantly do this at home and get relief. We'll start with the garments that you can wear. Know that you've got exercises that you can do, and you can refer to my exercise video specifically on exercises for SI joint instability. So I've got that covered in a separate video for you to start with. Now, fortunately, you can do those exercises with the garments I'm about to show you. First garment I'd like to show you is a pregnancy compression garment, and this is by SRC Health. This has a number of features that I really like for pelvic instability. Now, you can see here that there's a panel through here, and this is a panel of 3 layers of material, and that actually provides compression to the sacroiliac joints through the front and right through the back. So wearing it in a garment like this means that this bracing or this compression stays in place, and it also allows you then to sleep in this garment, move, do your normal everyday activities during the course of the day, and it's not going to move out of place. The other thing I like about this garment is there's a support gusset. So pelvic pain can also present through the front, through the pubic symphysis. So when the joints at the back start to move, then the joint at the front can also move. So this is an all-in-one compression garment that will help provide that stability. It's really for mild to moderate pelvic pain, not so much for the severe pain, and it's also a great way of preventing pelvic pain during your pregnancy. The fabric's really lightweight so that it's breathable when you're pregnant and you're not likely to overheat. SRC have kindly donated a 5% discount, and you can get that discount in the link below if you're interested in purchasing these garments. Now, the other thing I want to show you is a pelvic brace. A pelvic brace is more for severe pelvic pain, and it can actually be worn over the top of this garment as well. Let's have a look at the pelvic brace. Now, this is a pelvic brace. These braces compress or hold the pelvis together the way I was showing you before. Now, they fit low down, so they'd fit much lower than what you expect a normal brace to fit, around the hips, around there. And they actually are designed to pull tight and stabilise those joints. There's only two problems with these braces that I really see. One is that you have to do them up and undo them every time you sit down and then go back into standing. And the other thing too is they can move out of place a little bit as well. So there are some drawbacks to the brace. But as I said, they can also be worn over the top of the SRC leggings, so you could get double support for your major conditions where you've got really great instability. Now let's talk about ways you can get immediate relief at home. Now, the first thing you can do is when you're resting. And when you're resting, you want to be able to lie down and feel pain-free. The way that you can do that is lie with your sore side uppermost. So let's say you have pain in the left side of your buttock. You'd lie down with your left side up, lying on your right side. Put a pillow lengthways between your legs, and that will help to stop you rolling. And you might also like to add to that with a pillow against your chest so that your whole body is supported. You might have seen the body pillows that are also available too, to actually give you that whole body stability. When you roll, keep the pillow between your knees and roll like a log rather than twisting and rotating through your pelvis so that your body stays straight. So that's how you can rest, obviously on a firm mattress, when you're pregnant and you've got pelvic instability. When you're sitting, there's also some important things that you can do. Avoid sitting on a low chair, a low lounge. Try to opt for a firmer, supportive dining chair where you've got good higher support rather than the low support. Sitting down on a lower chair will place more pressure on your pelvis and your lower back. So try to sit on a higher, firmer chair if you can. Avoid crossing your legs. As soon as you cross your legs, you'll gap your sacroiliac joint, which is what you don't want to do. Remember, we're trying to stabilise that. So try to sit with your weight evenly supported. Sit yourself with good posture, nice and tall, in that nice, firm, higher chair. Now, finally, when you're walking around, this can be one of the biggest problems, can't it? My first suggestion is try to stand with your weight evenly supported, not uneven. So if you're nursing a toddler, for example, if you stand like that with your hip out, it's going to affect your pelvis. So try to stand, weight evenly distributed between both legs. Try to take small steps when you're walking. If you're taking larger steps, it's harder to control that pelvic instability. So small steps are the way to go for controlling that pelvis. Also too, try to avoid standing on one leg. So you can see your yoga pose here, the single leg stand. Try not to do that during pregnancy, especially if your pelvis is unstable. So you're trying to keep your weight evenly supported, and even when you're getting dressed, sit down to get dressed rather than standing on one leg to put your garments on. Sit down and dress in that manner. Finally, try to avoid stairs. You'll know that when you're on stairs, you've got that single leg standing effect happening again. If you really must do stairs, step up with the unaffected side first and then step together rather than taking all the steps at once. So it's going to be a step up with the unaffected side, step together, step up and step together rather than missing a step. So I think you can see there are quite a number of things you can do. First of all, to improve the stability in your pelvis, and secondly, to stop those uneven forces affecting your pelvis. So I really hope the information in this video helps you to stabilise your pelvis and understand what you can do to manage this condition well during your pregnancy. If this video has helped you, I'd really appreciate it if you could give it a like below, because this helps other women with pelvic instability find the video too. And don't forget that link below if you're looking for the SRC pregnancy support leggings. Thanks so much for watching today. I look forward to exercising with you again soon. Bye for now.